I'm sure you've heard by now the buzz around the ketogenic diet as a potential intervention in the treatment of schizophrenia. Today, we are going to be joined by Dr. Chris Palmer, who will share more about the science behind this and why ketogenic diet may be an effective intervention for schizophrenia. Dr. Palmer is a board-certified psychiatrist and an assistant professor of psychiatry at Harvard Medical School. He is also the director of the Department of Postgraduate and Continuing Education at McLean University. Dr. Palmer recently published his book, Brain Energy, which I would really recommend you check out. We will post a link to it in the description below, as well as other books that Dr. Palmer mentions in this video. All right, so I'm joined again by Dr. Chris Palmer. So excited to have you here talking with us today. Thank you for joining us.
Thank you for having me on.
So in the last video, we kind of went over the metabolic component of mental illness and that part of your theory and whatnot. And so in this video, we're going to dive more into whether the ketogenic diet is an effective treatment for schizophrenia specifically. So can you maybe just start off by telling us what exactly the ketogenic diet is?
So the ketogenic diet, although most people know it as a weight loss diet, and a lot of people probably think of it as a fad diet. Some people might think of it as a dangerous diet. I want to point out the ketogenic diet is actually a 100-year-old evidence-based treatment for epilepsy. It can stop seizures even when medications fail to stop seizures. It is also an evidence-based treatment for weight loss. We have dozens of randomized controlled trials documenting its safety and effectiveness for weight loss. And it's also an effective treatment for type 2 diabetes. We've got lots of randomized controlled trials showing that it can help reduce blood sugars, help reduce hemoglobin A1C. So what is it in practical terms? It's a diet that's low in carbohydrates, moderate in protein, and usually high in fat. And that last part I'm going to modify because if the person is overweight or obese, we may not need it to be a high fat diet. We might simply be able to do a low carbohydrate diet. And for somebody who has a lot of fat storage on their body, that will be ketogenic on its own. So a low carbohydrate diet can be ketogenic. But if that person then loses a lot of that weight, they may need to add more fat to their diet in order to keep it a ketogenic diet.
Right. So do you recommend the ketogenic diet to patients with schizophrenia?
So I am using the ketogenic diet as a treatment tool in people with schizophrenia. Absolutely.
Okay. And so how long, I guess in the last video you mentioned roughly 2 to 4 months. Is that common for people who are living with schizophrenia in terms of how long to be on the ketogenic diet before they start feeling alleviation of symptoms or improvement in mental health?
Yes. So the typical time course that I see is I usually tell people that I want them to try the diet for at least 3 months. When we start the diet, that first week or two, I'm going to be worried about symptoms getting worse. So I'm going to really warn them. I'm going to educate them. I'm going to help them through those symptoms, and we're going to manage those in a safe way. Insomnia, for instance, is a really common side effect of this keto adaptation. And as most of you probably know, people with schizophrenia or bipolar disorder, if they go without sleep, their symptoms can actually get worse pretty quickly. So that can be a really dangerous side effect. Usually within a couple of weeks, I start to see an antidepressant effect, but usually about 2 to 4 months is what it takes to start to see an antipsychotic effect. And then that can build over time. People can become even less symptomatic. So it's not that you get all of the benefits at 2 to 4 months, but usually within 2 to 4 months, we start to see an antipsychotic effect. And if we're not seeing it, then I don't know that I would ask the person to continue the intervention.
Okay, that makes sense. So I had mentioned in the previous video that I had tried the ketogenic diet briefly, and you also mentioned that it was seen as kind of fringe science for a long time, the ketogenic diet as a mental health intervention. And so, I had my own skepticism around it and whatnot. But could you maybe tell us what some of the studies that exist are that show or don't show evidence of the effectiveness of the ketogenic diet in treating schizophrenia.
So if I can take a quick step back, we've got lots of evidence of the ketogenic diet for epilepsy. And in fact, we have 2 Cochrane reviews, which are the gold standard meta-analyses in the medical field, showing that this diet is more effective than treatment as usual in treatment-resistant epilepsy. For schizophrenia, the research is new, although we have at least 5 clinical trials underway already.
Okay.
So lots of research coming down the pipeline, but what we've got right now is that, actually way back in 1965, there was a pilot study of the ketogenic diet for schizophrenia in 10 women with schizophrenia who were hospitalized. And the researchers reported that the diet seemed to improve symptoms of schizophrenia in those 10 women. Nobody picked up on that. Nobody really followed through with it. I think they thought, oh, diet, it's hard to do. And we were developing more antipsychotics, shortly thereafter. So I think people were just on the psychopharmacology revolution. So it kind of got lost. We've had several case reports now. I've published a few of them of the ketogenic diet for schizophrenia, improving symptoms. One of the cases was really important because what I showed was on-off effect. So in 2 patients with schizoaffective disorder, when they were on the diet, their symptoms got dramatically better. Both of them cheated on the diet several times, though. When they cheated on the diet, their symptoms would come back with a vengeance, almost like they stopped an antipsychotic medication.
Right.
Symptoms can come back with a vengeance. And then when they went back on the diet, their symptoms got better again. And then if they stopped the diet again, they got worse again. So there was this on-off effect suggesting that the ketogenic diet is in fact like a medication. The 2 heartening studies were 2 patients who have achieved long-term remission of schizophrenia symptoms off antipsychotic medications. One of them was actually 70 years old when she first started the diet. She had suffered from schizophrenia for 53 years. She ended up trying the diet really as a weight loss intervention, put her symptoms of schizophrenia into remission. She ended up getting off all antipsychotic and psychotropic medications altogether and was actually stable for 15 more years.
Wow.
Unfortunately, she passed away at the age of 85. Of COVID pneumonia. The keto diet did not kill her. She lost 150 pounds through all of this, put her illness into remission, was out of hospitals, everything. The largest study that we've got right now is a French hospital tried the ketogenic diet in 31 patients with treatment-resistant mental illness. And the patients had different diagnoses. So some had chronic depression, others had bipolar disorder, and others had schizophrenia. Of those 31 patients, 28 were able to do the diet. So out of the gate, 10% weren't able to do this diet. And I just need to mention that and be clear about that. But of the 28 patients who were able to do the diet, 100% of them got at least some improvement in their symptoms. 46% achieved remission of illness.
Wow.
And these are people with treatment-resistant disorders. So 28 patients, 46% achieved remission. 64% of the patients were discharged on less medicine than they went into the hospital on. And so it wasn't that we were increasing meds or even keeping meds stable, that a lot of them were actually able to decrease their meds and have symptom improvement. Mm-hmm. But as I said, right now we've got at least 5 controlled trials underway of the ketogenic diet for bipolar disorder, schizoaffective disorder, and or schizophrenia.
Great. So what you mentioned about the meds kind of leads me to my next question where, a lovely goal that I hold for myself is to eventually get off of psychiatric medications. And so, you mentioned a few people, but have you found that people with schizophrenia who use the ketogenic diet have been generally able to reduce or even get off their medications? Or, are medications still necessary in the treatment?
So I usually keep medications the same when I'm starting the diet because I want to make sure of two things. One, I want to make sure the person can actually do the diet and stick with it.
Right.
Because if they can't do it, then they can't do the treatment. And then there's no point in trying to change their meds.
Mm-hmm.
And the second thing is that I want to see if the diet at least starts to change symptoms. So I want it to see at least some improvement in symptoms. I don't expect full remission, but if by that 2 to 4 month mark, I'm starting to see some symptom reduction, I'll usually have them stay on the diet for maybe another month or so. And then I do start to slowly but surely reduce the medications. Here's one of the reasons. The medications that we prescribe can cause metabolic impairment. That's not news to any of you. They can cause weight gain. They can cause type 2 diabetes. They can increase your risk factors for cardiovascular disease. And those things are working against what we're trying to do with the ketogenic diet. So in some ways, some of the medications can actually interfere with the full benefits of the diet.
Right.
But as you probably hopefully already know, getting off meds is very difficult, can be dangerous. It needs to be done with medical supervision. It needs to be done in a very slow, gradual, safe way. But when people do that, those are actually the people that have the highest likelihood, in my experience, of achieving a full lasting remission. The ones who actually eventually get off all their meds and stay on the keto diet for a while. I usually have them throw in exercise. I have them do everything they can to improve their metabolic health. And those are the people who get the full and lasting remission.
Right. So I guess I'm just kind of, I've never heard a psychiatrist really talk like this, where, the ideal is to not be using psychiatric medication, but to be using other interventions such as diet and whatnot. And so I just wonder, as a psychiatrist, how do you kind of balance the current views of using medication and whatnot with this new, more holistic perspective?
So I recognized long ago in my career that some patients had adverse effects to psychiatric medications. That just like any medication, an antibiotic can cause adverse effects in some people. And even though antibiotics can be life-saving for others, for some people, at least a minority of patients, maybe they're not the best thing. So I have spent a lot of my career trying to balance the pros and cons of medications for different people. And if medications are improving symptoms, improving quality of life, reducing suffering, reducing dangerousness, I'm all for them, 100%. But when I see people chronically tormented by symptoms, not really getting better, disabled, not able to work, not able to function in society in ways that they want to, and they're taking meds, and the meds seem to just be causing side effects, causing weight gain and prediabetes and diabetes, I have long been an advocate for, well, let's maybe see if there's another way, because this path isn't really working out too well anyway.
Right.
What I now know with the science is that I'm convinced that sometimes at least some medications might actually prevent this full recovery. What's it like for me as a psychiatrist? Again, on one hand, when I'm able to help patients and see them fully heal and recover, I have people in tears. Tears of joy. I'm approached by their family members who are also just like, oh my. They say things like, you've saved our life. You completely changed my life. So that is obviously heartwarming. It makes me feel good. I'm grateful that I could help them. And at the same time, I'm heartbroken by the thousands of other people who are reaching out to me, begging me to treat them, who can't find a clinician who understands this or agrees with this or will even give the person a chance at this. It's heartbreaking. It's frustrating. For me, and again, it's not because I feel like I'm taking some wild speculative leap. I feel like I'm putting together established science in a concrete, logical way that leads to entirely new ways to think about and treat these illnesses. The most heartening thing is knowing that schizophrenia does not have to be a lifelong chronic disorder, that people can heal and recover from it. And, I'll go ahead and disclose some of my personal interest in this. My mother had a chronic psychotic disorder, and it ruined her life. And she developed it in middle age, at age 42. And so I saw her before and after, and it absolutely ruined her life. And she never got better from it. And when I think about how could her life have been different if we knew this then? If I knew how to help her? If the medical field knew how to help her? When I think about how her life could have been so dramatically better than it was, when I think about how that impacted me and all of my family, it kind of devastated our family. And I talk to people every day who are equally devastated. People suffering and their family members who are desperate to find new solutions. I'm out there fighting. I'm out there advocating. I'm trying to educate. I'm trying to change. And on one hand, it's inspiring and motivating, and I'm going to keep going. And at times it's heartbreaking because I get people who actually say, my son is dying. They have him on 10 medicines. He's in a state hospital. He can barely get out of bed. You have to help. He doesn't have forever. He doesn't have 15 years for all these studies to get done. He needs help today. I want to somehow get through to the clinicians taking care of that man so that they know at least there's another possible solution.
Right. Thank you very much for sharing your personal experience with it as well. It helps to know that you can empathize on another level with the patients that you're helping. So I guess my next question would be, how would you recommend someone with schizophrenia go about trying out the ketogenic diet as a means of managing their illness? You've said you very much recommend them doing it under the supervision of a practitioner. So that, of course, but is there any other steps someone should take before they try it out?
So the first thing that I'm going to say is that your practitioner probably is going to think you're crazy for saying you're crazy, or this Chris Palmer person is crazy. How dare he put nonsense in your head? How dare he fill you with false hope? First step is, if you can read the book, please read the book. Because I want you to be educated. I want you to be knowledgeable. I want you to have all the information. You can get it from a library. I'm not selling a book. I don't care. No. Get it from a library. Just somehow get the information. But it is a science book, and it's not super easy to understand all of it. So some people may, if you're not into science, or if your symptoms are preventing you from reading much of anything, and you can't focus. I know this well because I have patients all the time who tell me I can't read. The voices distract me. I can't pay attention. I can't remember what I read. Then I want you to at least go to a website, all free, brainenergy.com. We're working on establishing resources for you so that we're going to put together a one-page handout that you can take to your psychiatrist or mental health professional. That's going to outline all of this science in a very nutshell. It's going to give some of the academic research articles. So you as a non-medical professional won't care about them. You won't be able to understand them. That's okay. It's like reading a different language. That's all right. But the healthcare practitioner, it will get credibility with the healthcare practitioner. So that the healthcare, oh, this looks legit. And oh, these are published in really highly reputable journals. And oh, maybe I need to listen to this or find out a little more. And if you can convince your mental health professional to work with you on this, then more than likely that person doesn't know anything about the ketogenic diet, unfortunately. So you could work with a dietitian, and that's the best way. But the tragic news is insurance won't cover it right now. So insurance isn't going to pay for this dietitian. So if you can afford a dietitian, that is the easiest, best strategy. If you can't, I will recommend a book, Ketogenic Therapies by Eric Kossoff, Kossoff. That is a guidebook of the ketogenic diet for brain disorders, primarily epilepsy, but we're using it in the same way. We're using this as a brain treatment. And so I want you to get that keto information. There are lots of keto doctors and books and websites that all sorts of misinformation out there. So I really want you to have access to the medical version of this diet where we're using this diet for brain as a brain treatment, because that's what you're going to be using it for. And if you can put those two things together, so now you've got kind of accurate, good information on the ketogenic diet and how to do it, then you've got your mental health professional on board, figure out a start date, figure out when's a good time to get this going. If you can enlist friends or family to help you, that can go a long way. Even just one friend or a family member, somebody who's going to support you through this. If they are willing to do it with you, even better. They don't have to necessarily do it with you. They just need to know that you're doing this. You're doing this as a brain treatment. It's really important. And they're going to be there to support you. They're going to be there. So when you're tempted to cheat, they're going to be like, no, this is part of your treatment. Don't give in. Don't have the bread. Or they're going to help. They're just going to encourage you, motivate you. You're doing it. Yay, keep it up. That can go a long way. And then, as I said, make a commitment. I'm going to do this for at least 3 months and then see what happens. And because you may not notice improvement in symptoms right away. I can already tell you the first week or two, you're going to feel like there's no way I can do this diet forever. Oh my God, this is horrible. This is the worst diet ever. I want my bread and ice cream and everything else. That's the way it's going to feel. If you can actually get through 3 months, 3 or 4 months, you start to lose those cravings. And if your symptoms start to go away, it starts to become a no-brainer. That's when my patients are saying, why would I ever, I remember loving all that food, and wouldn't that be nice to be able to eat it? But I can't go back to being tormented by hallucinations and delusions. I'm done with those. Right. This new way of eating is I've got a new brain. This is great.
Mm-hmm. So for those of you watching, we will link in the description to the books that Dr. Palmer recommended. But I guess, do you have any practical information or practical tips in terms of what to adhere to around macros in terms of treating schizophrenia with the keto diet, like amount of carbs someone should be consuming to be treating the medical condition?
So as a rule of thumb, I'm going to say this. The beautiful thing about this diet is that we have objective tests that will tell you whether you're doing it right or not. You can measure your ketones. So the cheapest way to measure ketones is through these urine strips. So you can buy these urine strips on Amazon or at a drugstore. Most drugstores have them. And you basically just urinate right on the strip, and then either the strip turns a certain color or not. If it turns a color, it will tell you how your ketones are. If you can afford to get a blood ketone monitor, that is much more effective and accurate. They're expensive. The strips are about $1 a piece. But if you can afford to do that, that's great. So if you can afford a blood ketone monitor for schizophrenia, I'm going to ask you to achieve ketones greater than 1.5, usually somewhere between 1.5 and 5. Depending on the meds you're on and other factors, that may or may not be easy to achieve. Sometimes it can be really hard to achieve. But that is your goal.
Okay.
Blood ketones greater than 1.5, and then keep them there for 3 months if you can. Ketones will go up and down throughout the day. So don't freak out if, sometimes it's 0.7 and other times it's 1.8. Close enough. If you're getting above 1.5 at least every other day, you're definitely in the range. And then, so how to do the diet? Again, it really is going to depend on how much body fat you have on your body. It's also going to depend on any psychiatric meds that you're taking. So if you're taking something like olanzapine, which is Zyprexa, or Seroquel, or quetiapine, those increase insulin levels a lot. And that means it will be harder for you to achieve ketosis. So the meds are going to kind of work against the diet in a way. But as a rule of thumb, what I would say is aim for 20 grams of carbs or less a day. Try to, if you're not, if you're a vegan or a vegetarian, there are actually specialized diets that we can come up with for you. You can do a vegan ketogenic diet or a vegetarian ketogenic diet. So those are possible. I will be honest, vegan keto is hard because vegan is kind of sort of hard on its own. Keto is hard on its own. You put the two together, it's kind of really hard. So, right. So I'm not necessarily recommending vegan, but if you are a vegan and you're a vegan for ethical reasons or any other reason, and you say, I am not going to defy that, we can work with you. We can get you on a vegan keto diet. But as a rule of thumb, I'm going to say less than 20 grams of carbs a day. Try to get some vegetables in every day, but you can like low carb vegetables. So those are going to be things like broccoli, cauliflower, spinach, kale, salads, those kinds of things. You're going to be able to eat eggs, meat, fish, poultry, pretty much almost as much as you want. You're going to add some fats, so like adding butter or olive oil or other things like that. Some people really like heavy whipping cream. A heavy whipping cream is a way to get in some fats in a delicious way. So you can whip it up, you can add vanilla, you can add cocoa powder, and then it turns into vanilla or chocolate. If you freeze it, it turns into ice cream. If you put it in the refrigerator, it turns into mousse. It's really, some people drink it straight. So there are lots of things you can do with heavy whipping cream. So there are tons of delicious recipes. You can have sweet things, savory things, normal things. So a wide range. You can have Mexican dishes and Italian dishes and meat and vegetable dishes and fish and vegetable dishes. So lots of different options.
So one of the reasons that I stopped the ketogenic diet was because I was reading a lot of things that were coming up around how it was potentially unsafe to do this diet for prolonged periods of time. So I'm wondering if you can speak about this. Is this the case, or can you speak more to why it's not?
It is. So I firmly believe it is not. But again, it depends on what version you're doing. So first and foremost, if you're worried about safety, you're going to work with your medical professional, have them check your blood pressure, check your insulin or glucose levels, and check your lipids, your cholesterol levels and your triglyceride levels. Have them check those before you start the diet, because those are the things everybody's going to freak out about. The keto diet's going to cause you to have a heart attack. Well, I just told you the main risk factors for heart attacks. If those things all get wildly worse on the keto diet, then yeah, you've got something to be concerned about. But the reality is the overwhelming majority of people who do the ketogenic diet will notice their blood sugars come down, their blood pressure comes down in a healthy way, their triglycerides usually plummet in a very beneficial way, their HDL cholesterol, which is good cholesterol, will go up. Here's the caveat. Your LDL cholesterol, which is supposed to be the bad cholesterol, might also go up. That is what your doctor might focus on and say, oh, your LDL cholesterol went up. We got to stop this dangerous diet. Well, so I want to tell you about a study. There's a study called the VERTA trial or the VERTA clinic. They are using the ketogenic diet with people who have type 2 diabetes. Over 300 people. They've now been followed for over 5 years. The people in that trial have a lower risk for heart attacks than when they started the trial, even though their LDL cholesterol did go up a little bit. LDL cholesterol is one of many biomarkers for cardiovascular risk. So just because one got slightly worse, you can't ignore the fact that your blood pressure went from high blood pressure to low blood pressure. You can't ignore the fact that your triglycerides, which are really dangerous and not good for your cardiac health, they were really high before and now they're normal or they're even kind of on the low side. We shouldn't ignore those biomarkers. So I would pay attention to that. But as I said, the VERTA trial is probably some of the best evidence we have. People with type 2 diabetes are already at high risk for heart attacks. The people in that trial who got treatment as usual had more risk for a heart attack after 5 years, which is normal. That's what we see in people with type 2 diabetes. It just progressively gets worse until they have a heart attack. But the people on the ketogenic diet actually had a reduction in their heart attack risk. Okay. We do even have long-term data in the epilepsy world. There are people who have done this diet for 40 years because they have maybe a rare genetic condition that causes them to seize. And the ketogenic diet is the only thing that stops their seizures. And so some of those people, unfortunately, can't stop the diet after 2 to 5 years. They have to stay on it for life or just seize every day. And so they make the decision, well, I'm not going to seize every day. I'll just do this diet. I'll do this diet if I can prevent seizures every day. So they do that. For the most part, they have not been shown to have increased mortality rates. And again, we've got patients. It's not thousands and thousands of patients who've been on this for decades, but we've got enough patients who've been on it for decades to know, well, it doesn't seem to be killing people right and left like everybody freaks out about, like, oh, you're going to die of a heart attack. Well, no, these people on it for 40 years should have died of heart attacks then, and they aren't dead yet. So.
Okay, well, that's good to hear. So is there anyone who may have a schizophrenia spectrum diagnosis that you maybe wouldn't recommend this intervention for?
One caveat would be somebody who is already underweight and has an eating disorder. It's not even that I wouldn't use the treatment for that person, quite honestly, because I have used the treatment in some patients with a history of anorexia or even one person who had anorexia.
Right.
And the intervention ended up helping. One woman in particular she's one of the people who had long-lasting remission of schizophrenia symptoms. She had a history of an eating disorder. I'll share the whole story of her story, though. She was overweight when she started the diet. She ended up losing a lot of weight and then actually started to notice that some of her symptoms of anorexia were coming back. She ended up getting 30 pounds underweight because she noticed, like, wow, I have control and power. Like, I used to be overweight and now I'm skinny and I can get even skinnier and I know how to manipulate my carbs. And And she got a little bit of a high or power or sense of control, something from that resulted in her getting underweight. She worked with her psychotherapist to talk about that. Like, this is not okay. You got to gain that weight back. Like, let's get you to a normal, healthy weight. She's able to do that and able to stay at that normal, healthy weight for 5 years plus now. Probably 7 years now at this point. And actually finished her master's in social work, works as a social worker in a clinic. Nobody knows that she had been diagnosed with schizophrenia for 20 years. Nobody knows. And she in particular is not willing to be public because she has a new life. And nobody knows about her old life. And so she's an example of where this diet may need to be managed in a safe way in people who have an eating disorder or a history of eating disorders. There are some people who have rare genetic metabolic disorders where they can't metabolize fat effectively. Usually people should know that they've got that disorder. But if we're really talking about people diagnosed with schizophrenia, we may not. They may have an unrecognized genetic metabolic disorder that resulted in psychotic symptoms. Nobody ever did an appropriate medical or neurological or genetic workup. And they just assumed, well, this is just schizophrenia. And so, but they're very rare disorders. And you almost always people know, and they had failure to thrive as a child. They had other symptoms as a child. So if you've had a long history of medical problems dating to childhood, regardless of what they are, whether they're GI problems or failure to thrive problems or brain symptoms or anything, and now you're diagnosed with schizophrenia, I would want you to really actually go and just tell somebody, I think it's time for a decent medical workup to just make sure I don't have some kind of a genetic thing, because I'm thinking about trying this ketogenic diet and I want to make sure I don't have some rare metabolic disorder. But those would all be symptoms of, that person might have a genetic metabolic disorder. And it was showing itself all along.
Right. So I kind of want to wrap this up just by giving people kind of guidance on how to go about this. So you mentioned like some tools that you have on your website about how to bring this as a proposition to your medical practitioner if they maybe aren't well versed in the ketogenic diet as a therapeutic intervention. But if your practitioner is not familiar or able to support you with that, how do you find adequate support? You mentioned trying to find a nutritionist, but if someone can't afford that, what do you recommend doing in order to try to incorporate this as part of your treatment for schizophrenia?
The most important thing that I want to say is please sign up for our newsletter, brainenergy.com. It's free because I am being asked that exact question by hundreds of people. And we are doing everything in our power to develop support groups and or clinician trainings or patient and family educational resources. And so I'm really hoping that over time, we're going to have a lot more of those resources to offer you. But I really do have to come back to, if you're on 5 medicines or 10 medicines and you can't find a healthcare practitioner who's going to support you in this, it's really hard to do this treatment on your own, because part of the treatment is no longer just the diet. Part of the treatment might be safely, slowly trying to reduce some of those meds that are interfering with the full benefits of the diet. So those meds, doing the ketogenic diet while on 7 medications might help you get a 50% reduction in symptoms. That's great, but I want you to get a remission. I want your symptoms gone. And that means, according to the brain energy theory, that means we need to start slowly but surely, safely reducing these meds to help you at least have a chance at a full lasting remission. And I can't in good conscience tell people to wing that. I can't in good conscience tell people to do that on their own, because it's just so dangerous to do on your own.
Right. Okay, well, thank you very much. Thank you so much for sharing all your knowledge and expertise in this video and in the last video. I know I learned a ton, and it was really, really wonderful having you with us on the channel. Thank you.
Thank you, Lauren, for having me.
So a really big thank you again to Dr. Palmer for joining us in today's interview. I know I learned a lot from him today, and I hope that you as the audience did as well. Just a reminder to check out his book, Brain Energy, which we will link to in the description below, as well as the other books that Dr. Palmer mentioned and recommended in the video today. I would love to hear from you, our audience as well. Do you have experience trying the ketogenic diet as an intervention for schizophrenia? Please share with us in the comments below. We would love to hear from you. Thank you so much, everyone. And as always, wishing you and your loved ones good health. We'll see you in the next video. Bye.